Right then guys, morning everybody. Thank you for joining us this morning. I'm Shane Young from the Barnsley and Rotherham Chamber of Commerce, and we've got my colleagues Sam Christmas and Jade Dyer in the call from our neighbouring chambers. Today's webinar, titled Returning to Work Safely After Covid-19 Lockdown, is going to be presented by Andy Hooke from Quest. Andy is the Health, Safety and Training Business Partner at Quest, and Andy comes from a manufacturing, health and safety background and provides consultancy services in a wide range of environments and industries. Before I pass on to Andy, as we always do, I want to let you know that this webinar is being recorded and we'll be sending it out through all our chamber networks afterwards. That's Barnsley and Rotherham, Sheffield and Doncaster. All participants will be muted except for Andy during the presentation, but if you do have any questions, there's Jade, Sam and myself who can keep an eye on the chat box if you want to pop them in there, or raise your digital hand and we'll pick them up as we go, or definitely come back to them at the end. So I think we can all agree we want to get back to work, working from the office, from our business premises. Maybe it's not going to be on a full-time basis to start with, but we are pretty much unsure how to do this safely. So Andy's going to cover many topics to support us all in completing this transition safely. So I'll now pass on to Andy, who'll start the conversation. Thank you.
Brilliant, thank you Shane. Good morning everybody. I am just going to go through some things with you today, and so we're going to go through a little bit about how you can get your business COVID secure, how we can work safely during the pandemic, and really keep our employees safe and well, and protect our business really. So without further ado, I've got some slides to share with you, so I shall do that in a second. Hopefully you can all see my slides. So really, just to go through then, as Shane said, I'm Andy Hooke of Quest. I'm the Health and Safety Business Partner. A bit about us, if you're not too familiar with Quest and you've not had many dealings with us so far, we spent around 14 years supporting business. We were previously known as Kudos Consulting. For those who have been around for some time, will remember us by that name. We deal with a range of things from HR, health and safety, tax, VAT, insurance and legal services as a group, and we support the Chamber with many of those things through our advice line services, etc. We're based in Thermston in Leicestershire. For the health and safety side of things, we provide many services from audits, site safety management, support with legislative documentation, bespoke training solutions on the safety aspect of things, COSH, fire, work at height, manual handling, etc. We provide a telephone advice service, so those of you that you've got those burning questions regarding health and safety and HR or legal, give us a call. That's what we're here for. We also offer consultancy services directly to clients that require that. And we also have a wide range of documentation available via our website, which I will go through towards the end of the presentation. I will talk about that a bit more. So we're talking in the context of COVID-19. Why do we have a duty? Where does the duty come from? And actually, the highly contagious nature of COVID-19 means we've got to do something about it. We've got to put controls in place. And really, the duty ultimately, although there's guidance from the government, the duty in law comes from Section 1 and 2 and Section 3 of the Health and Safety at Work Act, which says, in a nutshell, you've got to protect your employees and you've got to protect other people that are coming into your business. Section 3 requires the suitable and sufficient risk assessment. Sorry, the Management of Health and Safety at Work regulations requires suitable and sufficient risk assessment. Now, this is where you hear people talking about the COVID-19 risk assessment. That there is a legal duty for us to conduct a risk assessment anyway on the business. And if there's more than 5 people in the business, there is a requirement for that to be written down and recorded, significant findings. But certainly within the context of COVID-19, we do need to do that as well. The law says you must bring the assessments to the attention of the employees. However, a thing I'm hearing at the moment, a lot of people have seen guidance and rough guidance on things that are saying, actually, you've got to display it on your website, etc. it isn't true. You don't need to display it on your website. Yes, it's something that you can choose to do. Businesses can do that. Typically, if you've got a larger workforce, or you spread across the country, things like that, and to give people easy access to it. But no, there isn't a legal requirement for you to do so. So let's talk a little bit briefly about restrictions on businesses before we go into the bulk of it. Naturally, not all businesses at the moment are permitted to open. Section 4 of the Health Protection Coronavirus Restrictions Regulations in England requires businesses, in particular with consumption on the premises areas of food and drink, to close, as well as a long list of other businesses as well. Those that have a takeaway facility can continue to do that. That is set to change, as I'm sure we're all aware, with the hospitality industry gradually reopening. There is an ongoing updated list all the time. You might want to make a note of the link here on the government website, which does give you the up-to-date list of businesses that are exempt and businesses that are required to be closed at this current time. Hot off the press yesterday, as I'm sure those of you that heard the announcement or saw the announcement, non-essential shops are permitted to open again from next week, along with some outdoor attractions, zoos, safari parks, things like that, outdoor cinemas. So that's really, really good news for the economy. Obviously, we know it's not great news for everybody, but certainly things are starting to improve, hopefully. And hopefully we'll see more and more businesses being allowed to continue. So really just keep checking. When I speak about legal responsibilities of employers then, and I spoke about the Health and Safety at Work Act, just to really give a little bit more information on that, a little bit more meat to that really, is Section 1 requires that you have a duty, so far as reasonably practicable, to ensure the safety of your employees. And Section 2 really just sort of gives a little bit more information on that and expands on that really, which says, in short, without giving you the long waffle, safe equipment and safe systems of work you've got to put in place. So that's going to include, you making sure your equipment is safe, particularly if you've been off for some time and your work equipment maybe has missed maintenance regimes, things like that. That's something definitely to bear in mind when you're coming back. System of work, of course, is actually, the whole making your business COVID secure really is a system of work. It's making sure that you are able to carry out your duties safely without putting people at risk. You must have arrangements for safe use, handling, storage and transport of articles and substances. You must provide training as is necessary to keep people safe. So that is going to be, as well as your basic business training, actually training on precautions that people need to take before coming into your business. When they're arriving in the morning, before they're leaving, when they're perhaps having contact, socially distanced contact, of course, but with clients, customers, things like that. How are we going to manage that and keep people safe? We must provide really a safe place of work, which is maintained safely, and you can get in and out safely. So again, really that kind of also hits that base with in the context of COVID. We've got to keep people safe. We must have adequate facilities available, and that is, your toilets in a basic sense. People must have access to drinking water. People must have access to certain things to keep them safe. Facilities for changing, etc. Particularly if you're say in a care industry, and you're having regular contact with close contact with people. Actually, we're providing the right facilities there for employees to perhaps wash or change after they've finished being in close contact with people. So the duties, just going a little bit further on that, I promise you this bit's nearly done. The Section 3 of the Health and Safety at Work Act gives general duties to people other than employees. So that's your visitors, your contractors, people that are coming into the business other than your people, basically. And every employer or self-employed person must conduct their business in a way not to expose people to risk. So that is by you taking steps to ensure that people are safe. Putting social distancing measures in place, putting signage in place. You've only got to look at the supermarkets, for instance, the measures they've taken. Yes, it can be frustrating sometimes with people queuing, etc. But these are all reasonably practical measures that these businesses have taken to sort of manage the risk. So we're doing that, and we must let people know about the risk to their health and safety is the short version to that. And those that are not your employees, we must give them information. So what is reasonably practicable? Often a question asked. It's certainly a very relevant one in the context of COVID. How far do I need to go with the measures that I'm taking to protect people? You know, do I need to provide everybody with their own private bubble, for instance? No, of course not. You know, it isn't always going to be practical to do things like that, but it depends on, you know, the type of business. When we talk about reasonably practicable, we talk about balancing the cost, time and effort to implement a measure, balanced against a degree of risk. At the moment, naturally, in some areas, the risk is relatively high. So that puts up the level of the cost, time and effort to balance the scales to keep people safe. You know, in a normal business, that can be, like I said, things like your social distancing, you know, your regular hand washing, etc., etc. What I don't mean is, and you know, other people is, you know, something of this nature. You know, is that going to be required in every business in your office? No, probably not. But like I said, so some basic standard of basically taking care of people and just putting measures in place really to keep people safe is going to be reasonably practicable. So we said about employees as well. Employees have a general duty to take reasonable care for their safety, and those may be affected by them at work. So that is them looking after their own health, them actually letting you know if they're ill, actually taking the responsibility now to follow the government advice on test and trace. You know, go away, actually be sure that I'm not putting my colleagues at risk by coming into a work environment or, you know, even a customer's environment where I'm putting other people at risk. You know, I certainly don't want to do that. And really that kind of leads on to the, you know, the duty imposed on employees as well to cooperate with their employer. Actually, if an employer's put measures in place to keep people safe, we really need to be sort of adhering to that as employees, and making sure that we're supporting our employers in terms of that. So the key thing then with risk assessments, it is one of the biggest ones at the moment. I'm not sure. I'm sure we'll talk in a bit when we come to questions. But in terms of risk assessments, is really your first part when we're opening the business, or even if you're already open. Have you conducted a risk assessment? You know, are we sure that actually we've taken into consideration the things that we need to do? So with COVID-19, as with all risk assessments, you know, we need to look at certain sections of, you know, what is the hazard, who is going to be at risk, how are they going to get harmed, and what are we going to do about it ultimately. So if we look at what is the hazard, of course, simple, transmission of COVID-19 leading to illness. You know, that's fairly straightforward in the context of this. But who is going to be at risk? What groups of people, or the types of people that might be at risk? So that could be employees as a whole, people that are in certain roles where their role requires them to be in close quarters with people, as I mentioned earlier. Visitors, certainly you're going to be unaware of their health condition. Are they likely to come into your business and declare that they've got COVID symptoms? Possibly not. I would say more than likely not, if they are. So that's certainly something to be more aware of, because it isn't something that we can manage internally, because we simply don't know, you know, if we've got coming in sometimes with visitors. Older people, certainly if we have more mature older people in our business that may have been identified as higher risk, yes, the restrictions are being eased on that, and certainly yesterday they'd announced, apart from those that are specifically shielding, now people in single households can form with another household, so they, you know, they've got that support network. But certainly in a business, you know, is it reasonable for us to expect, you know, people that are clinically vulnerable or potentially, you know, at higher risk to be in that environment? Okay. So then we look at how are people going to get harmed. So for example, they could come into contact with somebody, They could fail to maintain social distance, which is of course going to cause an issue with transmission if people are getting too close. Cross-contamination, of course, from surfaces, poor hygiene standards in the business, making sure really that we're doing everything we can to protect against that. Inadequate hand hygiene, so actually are we providing facilities for people to do that? Again, comes back to the welfare regulations. Actually we've got adequate hand washing facilities, we've got antibacterial soaps, etc. And then what are we going to do about it? So actually this is the action we're going to take to control it. So we're going to do things like social distancing. We're going to lay desks out in a certain way. Welfare facilities are going to be managed in a certain way. How are we going to do transport? People that are travelling in a van together, for instance, I think of tradespeople, certainly where they share transport to work. How are we going to manage that? Often, a tradesperson will pick another tradesperson up in the van. They will go to a job site. Of course, how do we manage that risk? What are we doing there? I mean, the current advice generally at the moment is, leaving the middle seats free. That's what they're saying. Opening the windows, keeping fresh air, things like that, for example. But it's how do we manage it? In any risk assessment, we always follow the hierarchy of control. Now this is a HSE thing that the HSE specify. This is the order that we manage things in. So we always want to look to eliminate the risk if we can. First of all, we keep people away clearly that are infected, which is the first step. Really, we have a robust procedure in place for that. So we've removed that hazard altogether. If we substitute the hazard, so can we substitute it? Probably not in this situation. Something less dangerous. Engineering controls. Now this is where you've got your guarding, your physical barriers, your screens that are in place, things like that. Physically protecting people as a collective protection measure. Which is isolating people from the hazard and keeping people apart. Notice in supermarkets, over the checkouts, etc., that they put these things in place. Administrative controls then really is your training, your supervision, your making sure you've got a system in place, which is what we spoke about. And then you will notice, obviously, I haven't mentioned anything about PPE, masks, or anything like that yet, because that comes absolutely last on the list, and that is the sort of bottom of the pile, and that is only to be used really where there's a residual risk and we can't manage it in another way. So it's far safer if we are able to keep people apart and use physical screens, things like that. If that isn't possible, for instance, we're needing to provide emergency first aid to an employee or something like that, then of course, obviously, we would look to use PPE and things like that, but it certainly shouldn't be the first thing that we go to. It is the last resort. So, continuing on with risk assessment, one area which I think is often overlooked, but certainly is very relevant at the moment in the context of people returning back to businesses that may have been closed for some time, and that's Legionella. Legionella, which is an issue, clearly in pipe work, things like that, where water has been sat stagnating for a while in the pipes. Warmer temperatures that we've had recently creates the ideal breeding ground for Legionnaires in pipe work. So we need to consider that as part of the risk assessment as well. So it isn't just the obvious stuff that you think of, but actually things like this as well. Legionella. So things like flushing your system through, so your pipe work, running your tap for a couple of minutes when you're opening your business up. Certainly showers, any shower heads, anything that creates an aerosol effect or a spray that can be breathed in is particularly higher risk. So we would want to make sure they're sanitized, given a really good clean. I mean, this should happen anyway, but especially when you've been closed for some time because things have been sat stagnating. As we said, it's more harmful when it's breathed in. There is a full guidance on it if you're wanting to read through. There is a lot of information on there, but on the hse.gov.uk Legionnaires, which gives you the full regulations. So how can we manage the risk of business? So as you know, the UK government has issued guidance. It isn't legally binding, but does provide some sound advice how you can comply with your legal obligations. A bit like an ACOP, for those that are familiar with that that phrase, which is an approved code of practice that the HSE issue for many areas of health and safety. So we look at that and we say, right, your duties fall under the HS statutory instruments and regulations, as we've said. So in a nutshell, to protect people, as we've explained, but in the context of the pandemic, we've got some key areas really that we need to be aware of. And that is minimising infection coming into your business, reducing the transmission business within your transmission risk within your business, and then eliminating the contamination through hygiene, really. So actually, we are, where it has got through the barrier, if you like, and has managed to get into the business. How are we managing that? How are we cleaning those surfaces? There's some surfaces where there's some research that has said, it can live for up to 5 days, in certain circumstances. If the humidity, etc., is right, it can last for that long. So, actually, proper decontamination of your workplace is essential. So, minimising infection coming into the business, we need to have a clear instruction and training of people on the specific requirements, so people know what's expected of them, they know what they need to do. We need to have a procedure for identifying those symptoms in the business and notifying their manager, notifying the business without actually entering the workplace, so we're not putting people at risk. Actually, what agreed procedure do we have there? Is there a specific phone number they call? Can they call out of hours? Is this, what do we do about that? Certainly something to bear in mind. If an employee has to self-isolate due to their own or household symptoms, how are we going to manage that? We appreciate, obviously, that sort of encroaches more on a HR element of it, which we can also help with. But certainly, how do we manage that as a business? Encouraging employees to avoid public transport is a really key thing. Now, as you'll be aware, the government have introduced face coverings as a requirement now for using public transport. But certainly, where possible, can we encourage employees to cycle in? Can we make facilities available for them to, store their bikes securely, where you perhaps wouldn't normally? Certainly, with less people in the office, things like that. Have we got an area where we could maybe provide that for employees to do that might not be comfortable otherwise doing that, so they can avoid public transport? They need to follow good hygiene practice. You need to provide, as I mentioned earlier, the facilities for them to do that. Encourage them to use it when they arrive, throughout the day, and definitely before they're leaving. So, hopefully they're not bringing anything in. They're going to keep clean through the day and not spread it around, and they're not going to take anything away with them. And potentially spread it further if there is something on a contaminated surface. Sanitising gels are brilliant, especially where hand washing is not available. Certainly mobile workers, things like that, peripatetic workers, it's brilliant for them to have. I certainly have myself when I'm out and about, but that doesn't sort of remove the importance of hand washing. Hand washing is the most important thing. We should always prioritise that over using the hand gels, as per the government advice. But it certainly is a nice extra thing to have available. So going further on, minimising infection coming in, what process have we got in place for goods and post being delivered? Do we look at quarantining goods? I mean, currently the advice is look at around 72 hours of quarantine. The risk is minimised. Do we disinfect all goods that come in the door? Do we have another procedure in place? Certainly, if we're doing that, people that are handling the post, that would be a circumstance where you probably would, because it is an unknown. It's potentially things you don't know who's handled that before, where it's been, anything like that. Certainly, PPE probably would be a consideration there as part of your risk assessment. Ask employees when they come in. Certainly a key step, really. Just as simple. Actually, have you been exposed to anyone within the last 14 days? Could you have symptoms yourself? Another way is temperature checks that people are doing. Some organisations, I mean, quite famously, I think Amazon and a few of the other large retailers and warehouse, they've implemented temperature checks. Anyone that's sort of over 38 degrees or thereabouts, it isn't a confirmation they've got the virus, of course. There can be other reasons why people have got a temperature. The thing is, if people have jogged to work, for instance, we spoke about people avoiding public transport, they might choose to jog to work. Actually, their temperature could increase through that. So actually, in that case, if they're taking a temperature, actually, and the employee says, well, I've just jogged to work, that could be a reason why they've got an increased temperature. Don't immediately take that as, they've got the virus, get out. It is a case of, okay, have a sit down for a few minutes, away from outside, away, calm down, cool down. Right, let's check your temperature now and do it in a reasonable manner like that. Of course, we need to do that contactless and make sure we've got consent from employees. An important thing to remember is making sure you are complying with GDPR regulations for managing and storing personal data on that. If we are recording data from employees regarding temperature checks, etc., health questionnaires, of course, that is all subject to GDPR regulations if we are storing that. So you do need to be aware. I would always advise, we can give advice. If you aren't sure, you can also see the Information Commissioner's Office, the guidance. They'll give you full guidance on that. So symptoms. At the moment, the current guidance is a high temperature. And really, just to explain that, it means you feel hot to the touch on the chest. Doesn't necessarily mean measuring the temperature. Not everybody's got access to a thermometer. Coughing a lot more, 3 or more coughing episodes in 24 hours is the specification they've given, or loss or change in sense of taste or smell. Any of those symptoms, they should be self-isolating and referring to the NHS coronavirus website, where they can arrange a test and follow the test and trace procedure. Okay. There seems a lot of confusion at the moment. A lot of questions I'm getting asked is actually, if somebody is self-isolating, how long do they need to self-isolate for? Now, the current guidance is, as I'm showing on there, if somebody is, the illness has first started and they've got symptoms, actually, the whole household then needs to isolate for 14 days. The person who was ill only has to isolate for 7 days. If they, like I say, the second person then becomes ill, they carry on for 7 days. Everybody else who hasn't become ill basically follows the 14-day process. So we go through that. So washing hands regularly, and that is proper hand washing. These posters are available on the website. These are the official posters that they've released regarding hand washing. It sounds really silly. You would be surprised how many people aren't aware of how to wash hands adequately, and we'll just get them wet and not actually wash them properly. So it's always a good idea to make sure that we're communicating that and how we can do that properly. We need to make sure things is available and make sure that people are following that and actually washing their hands. Another thing is, what does it mean for drivers and others visiting sites? Those that are going out to visit other sites, delivery drivers, things like that, people that, again, peripatetic workers that are going out to sites, and indeed others visiting your sites. They don't have hand washing facilities. Can I refuse them using my facilities? You should always have a plan in place. If you're going out and about, having hand sanitizer gel things, if you haven't got access to facilities. However, it is a legal requirement that if facilities are available, for you to give access to them for people that are visiting your premises for work. It is against the law for you to refuse access. There is actually a letter that the government have sent out, as you see there, that basically they've provided is available on the website. The idea for anyone that's going out like that, to have a copy of that letter to hand, actually from the HSE, which sort of reminds those people that are refusing to give access, actually, yes, you are legally required, and here's why, and it just gives you something. Not everybody will refuse, not everybody it would be an issue, but some it is, hence they felt the need to produce this letter. So yeah, I say that is available on their website to download. So maintaining social distance in the workplace is a really important aspect of reducing the transmission risk. at least 2 meters from those who are not in your household, using signage around to manage that, reminding people to observe. Where it can't be achieved, in line with the hierarchy of control, we should look at physical things in place, screens, barriers, things like that, before going to PPE. So that is, things like restricting lift use where possible, ensuring, of course, where it's available, where people require it for needs. But if it is, actually, we're marking it out properly. Are people using it? You can see there's an image there of a similar way. Managing the canteens, rest areas, making sure that social distancing is maintained in those areas, that people aren't sitting too close together. Making sure that we've got a clearly defined walkway around the organisation. Actually, that if we can, where possible, having a one-way system so people are not coming in close contact. Avoiding employees being too close or sitting opposite each other, using screens, as you can see some examples I've mocked up there below, with how we can have a workstation, both without the guards and with screens or guards in place, how we can lay that out to try and keep people safe. Of course, it's all going to be relevant to your business and how you set things up. What works for one business isn't necessarily going to work for another. However, as long as we're able to sort of those key parts of, keeping people safe, maintaining hygiene, that's the most important thing. Another aspect of maintaining social distance is dividing people up into cohorts. So actually where we can keep a certain group of people together in one cohort, rather than mixing with others in the workplace. So actually if one person out of that cohort becomes infected or there is a risk, we can isolate that cohort, but actually the rest of the business is potentially less at risk of becoming infected, and actually there's a potential that they may not have to isolate if we're sure that we've maintained that distance and they haven't been in contact with each other. Certainly helps. We said about a small group of 4, it depends on the size of your business, but certainly small groups, so we're not affecting everybody. Welfare facilities. So how are we going to manage the toilet and shower facilities? How's that going to be managed to maintain social distancing? Changing rooms, how are we going to manage access to those? Are we going to stagger the use of those, make sure that people aren't using them all at the same time? Kitchen facilities at work, really key question at the moment. I think just about everybody I've spoken to has asked me that question. What do we do about kettles? What do we do about toasters? Things like that. But actually having, facilities in place where, having wipes, things like that in place, where actually, and have a process where, people are cleaning them down after they've been used, after each use, just to make sure we aren't transmitting anything. One of my colleagues actually the other day regarding door hangers, similar to like what you would find in a hotel, for instance. Actually having some of those, again, templates are freely available to download online. Put it how you like. If somebody's using a toilet, somebody's using that facility, just hang that on the door. Prevent somebody then coming into that area, unexpected while you're using it. Again, helping you to keep that social distance. So hygiene, we need to make sure we're doing a deep clean. If there's been a suspected case, we need to follow the strict guidelines. It is a very, very detailed document which is available there, which explains exactly what we need to do in a non-healthcare setting. If we've had a suspected case, what process do we follow? So it's really important that we look at that, and that will involve PPE, certain methods, double bagging, cloths and things like that, etc., as required. We must have soap and running water available. It must be provided and regular hand washing encouraged. Antibacterial surface wipes, we said, or disposable wiping materials, so blue roll or paper towels, along with sprays. And ensure employees, it sounds really simple, but employees get some sort of training on that to explain how to do it, how to effectively clean, rather than just getting a countertop wet, actually cleaning it. So employees store their stuff away from everything, so actually there's less risk there of their personal belongings becoming contaminated. Don't touch communal surfaces where possible, but where we are, make sure we're washing hands. before we're using communal equipment. Provide wipes in certain areas, you know, I'm thinking photocopiers, laminators, you know, guillotines, anything, equipment like that, communal stuff. Actually make sure they're wiped down so we're not contaminating other people. And any high contact areas really, so desks, IT equipment, doors, water coolers, things like that, that's all something that really we should be looking at doing throughout the day, and making sure that that's regularly wiped down to minimise that. So quickly on to PPE. A lot of people asking about masks. Should they be wearing masks at work? Really, just to give some, and a lot of people, I think there's some confusion over masks and face coverings. So just to quickly touch on that, a mask, an RPE equipment, which has a rated particle filter, such as the one pictured there, known as a dust mask. A lot of the time, in a lot of businesses, government advice says that if you're wearing them for normal business activities, so if you're cutting wood up or drilling or something like that, and you're generating dust, or you're using some sort of chemical that you've risk assessed that you need them for, that should continue as normal. However, the government doesn't advise that masks are worn except for certain areas where it's required, just as a precautionary measure. If employees come to you and insist that they feel safer wearing masks, etc., we should certainly be supportive of that if where we can, but it certainly shouldn't be something that's encouraged. If anything, it should be sort of discouraged really, unless there is a specific need for it. If there is a requirement that PPE is required in a risk assessment, then you must provide it. Training is really important on putting masks on and taking them off. I see so many people that are wearing masks on their chins or just over the mouth, and actually their nose is exposed. It isn't really giving you any protection by doing that. People with very large beards, certainly they've got the mask, and if it isn't forming a seal on the face, it isn't giving you that protection, and that is one of the issues with masks, is it gives people that false sense of security. Actually, I'm wearing a mask, I'm okay, I can get closer to people than I normally would. It isn't strictly true. So we always say that the social distancing is the most important thing. So you've got your non-rated cloth face coverings, really, that the government keeps talking about, and that's regarding, at the minute, is now a requirement for you to wear on public transport, and where possible, the government have also said, and that is things like this pictured there, or the government have also issued guidance on making your own, which there is a guidance on. And that's really where you can't maintain, distance, where you're close to each other. Helps to reduce transmission from yourself that's wearing it to other people, but it offers you very little protection from other people if you're the one that's wearing it. So yeah, I would bear that in mind. There's so many different versions of it. Again, there's a full guide that the government have put together on making your own. I think they demonstrate using an old T-shirt on their example, and cutting it and creating a mask, and it's a bit of a Blue Peter project that's there on that link if you have a look, those that haven't got access to them commercially. So liability, just to quickly touch on this, and we are nearly done. I know we are running, we've overrunning a little bit, so I do apologise, but I'll try and get through this quickly. Liability is again a big question that's coming up at the moment. Actually, what's going to happen? Am I going to be liable? Am I going to get prosecuted if there's a gap in my safety management system, and actually somebody makes an allegation to you that it's your fault I've got COVID-19, it's your fault I'm ill. Actually, where do we stand with that? Now with the HSE, it's possible, of course it is, but it's likely that the HSE are going to focus on serious offences. Things like where nothing's been done, where businesses have shown a blatant disregard for the guidelines and keeping people safe. They will only usually undertake a prosecution where it's in the public interest to do so. So in the most serious cases where there've been serious failings. Just because somebody's just contracted the virus, it doesn't mean it's happened as a part of your business and place of work. But if the people do report it to the HSE, they might ask you what you've done and what measures you've got in place, depending on their resources at the time and how busy they are. They may even issue a notice to you. That doesn't mean a prosecution. They may say, right, we expect you to do this within this amount of time. If you do it, there'll be no further action. There is that. In some of the serious cases, if they do find a material breach, just to sort of let you know, they do now use a thing called fees for intervention, which is £154 an hour. Don't be scared by that. It isn't used all the time, but if they have to get involved and issue notices and things like that because of serious contraventions of the legislation, they have got that power to do that. But if you're following the government advice, protect your business, protect your people, and reduce that risk, really. If you do get the HSE, get in touch for any reason. You need to cooperate with them fully, swiftly. Don't put them off. Of course, come to us. We can provide advice to you. We can provide support. We provide consultancy services to help you through that. So don't be a stranger. Get in touch. That's what we're here for. Touching a bit more on liability. I promise you this is the last part. Again, we now talk about civil liability. So again, is my employee or my employee's family, are they going to sue me if somebody does get ill from COVID and they're blaming the business? Those that are not aware of the legal system in the UK in terms of civil liability, just to quickly go through this bit. For a civil claim known as a tort of negligence to be successful in UK law, there are 3 key tests. That is that there's a duty of care from the defendant, which is your business, to the claimant, which is the person affected. As an employer, there is always an automatic duty of care to employees. You've also got a duty of care to visitors, contractors under the Occupiers Liability Act and Health and Safety Welfare Acts, etc. So that's not in question. But the key thing really is, was that duty of care breached? If you're following the government advice and your legal duty is to keep people safe, you've done a suitable and sufficient risk assessment, you've got a suitable safe system of work in place, all the things we've spoke about, keeping a record of it to evidence it. Actually, we look at in law what a reasonable person would do, and that is the actual phrase used in law. What would the reasonable person do in this situation? You've taken all reasonable steps that you can on the known risks at this time. But what's reasonable depends on the level of risk, how likely it is it's going to happen, and whether a control measure is disproportionate to the risk. Have we gone over the top, or would it be over the top to implement something like that? Given the knowledge that we had at the time. And finally, the third test is really that breach led to the harm caused. Now, this is going to be the hardest one to prove. It's not out of the question that it could happen and that somebody could bring a claim. However, it's going to be incredibly difficult for them to prove that it's happening within your business and isn't something that they've picked up elsewhere. So, yes, it's absolutely possible. In reality, I think it would be very, very difficult for it to be specifically aimed at your business, as in, and proved that the contamination did come from your business or the infection did come from your business. So just to summarise, with there at the end. So the takeaways here really: make sure we're doing a suitable and sufficient risk assessment for the site. We need to make sure we're looking at those who are especially at risk, so those that are clinically vulnerable, etc. Share those significant findings and implement a safe system. So that is making sure that people know what they're doing and why they're doing it. Don't just say you're doing this because, actually explain the rationale why we're doing it that way. Actually, people are much more likely to become engaged and get on board if we're able to sort of share that with them. Implement social distancing, vitally important. Ensure we've got adequate hygiene facilities available on site. Communicate with staff so they know what to do. Ensure a good hygiene system. Don't forget your statutory equipment inspection and maintenance has taken place and is up to date. Again, like I said, it's something that gets forgotten, especially during this time. It's not the first thing that comes to mind, but it is a legal requirement. Don't forget, we've got an awful lot of free resources available through the website, which you can access through your credentials through the chamber, which they will give to you. I'll quickly show you that. If you bear with me 1 second, hopefully my screen will work. Hang on a second. Got this ready here. So what we've got here, the website. If we're going on, you'll be presented with a login screen depending on which chamber you're from. You can find the index to all the chambers here, which will explain exactly which one. Let's just pick one of you guys that are on today. Obviously, Barnsley and Rotherham. You'll be presented with a screen like this, where you'll get your username and password from your chamber. I've got a test one here. I'll just quickly show you how to access that. You'd put in your details here, and then you'll be presented with a screen. Hopefully, there we go. A screen here where you'll see a document library. That is where you'll find all your templates, guides, everything health and safety related and HR related, I might add also. For this, I'm concentrating on the health and safety, but certainly you can see we've got an awful lot of HR related stuff as well, which is equally important, especially at this time. But in terms of the context of health and safety, I'll just quickly show you where the risk assessments are. So in the health and safety library, go into risk assessments here, and you'll see there is at the bottom, Covid-19 risk assessment template, which we put together, which is basically just a rough guide, really, a starting point of how you can conduct a risk assessment. There's also just about every thing you can think of on here as well to support you. Of course, as always, get in touch with us. If you can't find anything you're looking for, I'm sure we can help. So just to come back to that. And then finally, really, there's a government poster. The link is incredibly long with lots of noughts and ones and letters and numbers. But if you search on Google your COVID poster, you'll see that there is a second. There we go. There's a poster that the government have put out, which isn't a legal requirement, but it's a nice idea for you to be able to put out and just sort of demonstrate that you are undertaking reasonable steps and to keep people safe. And I think that's it from me for now. So I think we'll be taking some questions if I hand back over to Shane. Yeah, from there.
Yeah, thanks, Andy. Excellent content and advice given there. And if you were in one of our meeting rooms doing this, then I'm sure everyone in the room will be giving you a big round of applause. So you'll just have to imagine that virtually on this occasion.
Thank you.
But yeah, thank you. Joking apart, it was excellent. I think a lot of the businesses that are in the call today all have different premises, offices, different sites, and I think it was relevant for all. I'd just like to open up a conversation with everybody in the room. Does anybody have any questions to ask Andy? This is the time to ask a health and safety expert, really, in terms of your business, what you think you need. Just put Andy on the spot a little bit. We did pre-warn him beforehand. If you want to just raise your digital hand.
Don't be shy.
Then Jay can navigate around the digital hand movement, so to speak. Anybody? Come on, guys, there must be one. Alan, you must have a question. You've always got a question.
Jane, I just saw Tavco PPE Supplies put his hand up.
Brilliant, Rachel. Do you want to unmute Tavco PPE, Jade? And over to you.
Oh. You're incredibly garbled.
Unfortunately, I don't think any of us understood that, unfortunately. Jade, do you want to just put him on mute, unfortunately, and I'll come back.
On mute.
Yeah. Sorry about that, guys. I'm sure it was a very relevant question, and I'll try and find out what it was. Jade, do you just want to send him a private message, ask him to type it out so he can do it that way? Would that be all right? Joe, I saw your hand was up. Were you giving a clap or do you have a question? Oh, you're on mute, Joe. There we go.
My question is, I've heard a bit about doing a consultation with staff to encourage them to come back to work, but I didn't know if that was for a certain size of business or whether it's generally good practice, but what would be your recommendations around consultation with staff?
I mean, really, it's just having that discussion with them. I mean, crucially, it's you know, can employees work from home? You know, ultimately, if employees can work from home, they absolutely should be at the moment. You know, have that discussion. It's certainly worth having that discussion with employees where possible. You know, the magic of Zoom, etc. Nowadays, have that call and just, you know, sort of explain to them. You know, look, we're looking at getting you back into the business. We're looking at, this is what we're looking at doing. Being open and honest from an early stage, you know, and you know, what can we do to make you feel safe? You know, you're probably not going to be able to do everything, but you know, by asking that question, you know, you're demonstrating that actually we care, you know, and we're interested what you think as an employee, and that we are committed to keeping you safe. I don't know, does that kind of help?
Yeah, that's helpful, thank you.
Okay.
Andy, we've got a question from Rachel Ryan in the chat, so I'll just read it out to you. From the point of view of a one-way system, can we ignore fire regulations and leave fire doors open to reduce cross-contamination?
Very good question. Yes and no. Of course, you can't ignore fire regulations. Fire regulations are there for a very good reason. That said, there isn't a specific thing that says, believe it or not, that fire doors must be closed. There is a requirement that you've got to take all reasonable steps to protect people in the event of a fire. Now, the guidance and advice from the Chief Fire Officers Association, which basically says, yes, fire doors should be closed, things like that. However, in the current situation, I think there is a little bit of leeway, as long as we're taking that into account as part of our fire risk assessment, and we've got an agreed process in place. Well, actually, we're talking about internal doors now, you know, where if we are required to keep them open, of course, the biggest thing at the moment, the risk to us is the contaminated air, of course. So we need that ventilation. That is a key step, really, that we should be doing. So by having them open, what process have we got in place to make sure they're being closed? You know, things like that. If we've got a system in place where we can say, right, the minute the fire alarm goes off, the minute we've got, you know, a situation, you're designated to make sure that door's shut. You know, the people that are closest to it, on your way out, make sure that's closed. You know, make sure that happens without fail. We've also got dozens online. If you look, there's so many suppliers that sell them, but you can purchase battery-powered door release mechanisms, which are the legal alternative, basically, to having doors pinned open, so fire doors, etc., where they've got a microphone built into them. They will listen for the sound of the fire alarm. As soon as it hears the fire alarm, it will automatically release the door. And they're very, very easy to install. It's literally a battery-powered unit that screws to the wall, screws to the door, holds that door open, and is legally compliant, because the doors then will close in the event of a fire. But yeah.
Brilliant, Andy. Thank you. We've got a couple of minutes left. I've just got another question from Rachel Ryan, and I think it's more relevant from a HR perspective, so your colleague might want to come in on this. But Rachel's put, if we have an employee who's known to breaking the rules on social distancing outside of the office, but the company has put in place appropriate restrictions, where does the company stand from a criminal liability view? This might be more relevant for Emma from a HR point of view, or you can answer, Andy, entirely up to you guys.
I mean, from a from a health and safety slant, certainly it is, as a business, what reasonable steps have we taken to manage that? If we're, you know, aware of that risk where an employee is breaking the rules on social distancing, and they are potentially at risk of bringing a contamination into the office, you know, but do we actually know that there is a risk there? Do you know that they are actually bringing that in? Yes, they are breaching the rules, but you know, we also have to sort of, there's a fine line that employees are entitled to a private life and things like that, and we have to be careful not to sort of encroach on that. Obviously, the human rights, etc., you know, and things that we're not encroaching on people's private lives. Actually, yes, if we're aware there's a risk there, we should be doing something to manage that. So actually, maybe having a discussion with the employee and risk assessing that on you know, individually on each sort of situation. Could we reasonably say to the employee, you know, actually, you know, if there's a risk there, could you go and get tested, things like that. I know of some businesses where there's been situations where people have been a part of a social gathering or something like that. And I know certainly over the current news stories, which I won't obviously discuss, but things where people have been in close quarters with current things that have happened in the media. And I know people then, I know there's been an influx of testing that's taken place after that, people sort of precautionary testing, just to be sure they aren't putting people at risk. I don't know if Hema wants to come in, if there is anything from your side of it.
I suppose the only thing that I would add to that is a company cannot control what people do outside of the workplace. However, in these difficult times and such strange times, what we've got to make sure is that we do communicate and we make it very clear to all staff what expectations are. In terms of work, if I give you an example, someone who works, let's say, in a doctor's surgery, if they are breaking the social distancing rules or any of the other rules that there are, and that then puts their position at risk because the doctor's surgery no longer wants them then to actually come into the workplace because they pose a risk to themselves and their patients, etc., then there is a direct link there in terms of what they're doing in their private life versus what's happening in the workplace. So from a work point of view, the companies have got to be very clear and remind their staff that yes, we can't infringe on your private life and you've got every right to do as you please. However, just be mindful that your actions outside may impact on your work. And if you don't comply and something does come to light, then we as an employer will have no option but to actually deal with that appropriately. And this is part of the consultation, but also as part of the clear message that we need to give to all staff that this is very serious and this extends further than just the workplace and our responsibilities. There is also that responsibility from the individual to do the right thing as well. Does that help, Rachel?
Brilliant, Emma. Thank you for that. I've got two more questions, and then what we're going to do is so if you have any more questions after the two that I've read out, what the best thing to do is actually use the telephone advice line that you get as part of the Quest services through your chamber membership, which Andy touched on. So all chamber members have access to a number of templates, documents on HR, health and safety and legal services, and that's what Andy showed you at the end of the presentation. So if you want your logins or the telephone advice number, please ask your chamber and we can send them to you today. That's no problem at all. So I'll just finish off with two questions because I'm conscious of time. Caroline Needham of Unique School Solutions has asked, are service officers legally responsible to make adaptations to things such as internal doors to avoid handle contact? There are at least 6 door handles that need to be touched before we reach our office. And that's a shared office in a serviced office provider doesn't seem to see this as an issue. Can you touch on that, Andy?
Yeah, absolutely. Yeah, there is a requirement ultimately for them, as you know, the management of the building. You know, the people, the owners of the building, is the Occupiers Liability Act, for instance. You know, there's various pieces of legislation that actually says that building, you know, you've got to do everything reasonable to keep people safe. Actually, I certainly would be having a conversation, definitely putting that in writing to the managing agent or the landlord, whoever it is that you're in contact with, for that organisation, and say, you know, what are you doing about it? You're putting my people at risk here. You're potentially putting the public at risk. You know, what steps can we take to mitigate that? You know, there certainly is a requirement, especially where you're in a multi-occupancy building, for you to coordinate with other users of that building. You know, people where you've got shared entrances, shared access, shared welfare facilities even, you know, actually where you should be coordinating with each other to make sure that you aren't, you know, affecting each other there, and making sure that we are sort of all working towards the common goal, if you like. So yeah, I would certainly be having that conversation with them and letting them know that yes, it is an issue, and yes, we do need to do something about that. I think you're quite limited, obviously, in terms of you sort of going outside your area of demise, if you like, for your office area. But certainly, I would look to have that conversation and let them know. And if they aren't, then you know I would potentially look at escalating that further with them. You know that there is, if they aren't taking adequate measures to keep you safe, the HSE do advocate, you making a report to them if need be, to let them know actually that people aren't taking it seriously, and then the HSE will deal with their own investigation. Hopefully it won't get to that. Hopefully we won't, and I'm sure they will listen. I'm sure it'll be fine. But it's certainly something to be aware of. Hopefully that answers the question, Caroline. Is that okay? Do you want me to anything else on that?
We're getting a few nods, I think. So I think that's good. That's good, Andy. Thank you. Final question from Jill Wood. Jill's put in there. You briefly mentioned ventilation, answering the question about fire doors, and there is guidance around ventilation in the workplace relating to COVID. What are your thoughts, Andy, around the actions businesses should be taking, and in particular where a business is in a multi-occupancy building which doesn't allow localized control?
Basically, any system where it is a recirculated air system or anything like that, where we've got ducted airflow, unless it's a fresh air system that's bringing fresh air in from outside, shouldn't be operating. It shouldn't be recirculating air in the office at all at the moment. Certainly is my take on that. And certainly a lot of the guidance that's out is that we shouldn't be doing that. Doesn't mean excluding every ventilation system, things like that, but certainly where it's recirculated. If it's a shared system, even more so, because you potentially, if people in your office are infected, that's getting into the air system, which is then being spread to the entire building. So that is a particularly high risk to me, and that again would be a situation of discussing that with the managing agent or the landlord of the building, and actually saying, look, we need to close this down. We need to stop where we're affecting other people. Certainly, if you've got control within your unit, then utilise that. If you haven't, as you've mentioned on there, it doesn't allow localised control, then I would certainly have that discussion with them and just say, look, we need to shut this down. We need to shut it off temporarily while this is going on. Again, it's an important measure really to stop the spread. I hope that answers the question. Did you want to ask anything further on that? Brilliant.
Jill's put in there, thanks. So, thanks for that. So I'm just conscious of time, so what we'll do, we'll draw the webinar to a close. A big thank you to Andy and Andy's colleagues at Quest for presenting today. I thought it was fantastic and very relevant during these times that we see ourselves, and hopefully we can all get back to work as safely and as soon as possible, really, in terms of back into the offices. So thank you to everyone for taking part. Our next webinar with our colleagues at Sheffield and Doncaster Chamber is actually on Tuesday next week, Tuesday the 16th at 10 o'clock, and that's going to be presented again by Quest, and that's going to be focusing on the HR challenges, and we're going to be touching on and talking on, I'm sure there'll be lots of questions around the job retention scheme, not the furloughed scheme, the job retention scheme. So we will we'll discuss that next Tuesday, and what we'll do, we'll send a follow-up link with Andy's slides on there as well, and also the Quest details where you can speak to Rachel and Steve directly at Quest regarding the services. So thank you to everybody. On behalf of Sheffield Chamber, Doncaster and Barnsley and Rotherham, enjoy the rest of your day, and we'll speak to you soon. Thank you, guys.